Here's radically onto China overnight issued some strong rhetoric and promising consequences for the deployment of the THAAD missile system to South Korea. If you could respond to that.
So on the first piece, I think, look, one of the things that's important to understand about this process that's very different from when the Democrats did it. You recall then Speaker Pelosi said you're going to have to read the bill to know what's in it. I think there's a big difference. This is the bill. It's right here. It's on the website. We're going through regular order. If you go to the House of Representatives website, Speaker Paul Ryan's website, it's listed. Everybody can read it, and it's going to go through what they call regular order. We're not jamming this down anybody's throat. It's going to go through a committee process. All parties involved, all representatives in the House will be able to have input into it. I think that's the way to conduct this process, is to do it to allow people to watch the process happen in the committees, allow members of Congress to have their input in it, to make amendments, to see that we get the best bill that achieves the goal for the American people. When it was done the last time, it was jammed down people's throat. And look what happened. You had 974 pages that people struggled to read afterwards and figure out what had just gotten passed, and the consequences were frankly devastating. So to your point about keeping your doctor, in a lot of cases you've lost your doctor for a couple reasons. One, they may not participate in the plan. They may not take insurance at all anymore. Two, they may not take Medicaid. Or three, they may not take Medicaid. And the list goes on about why they might not be there. Or your plan, the plan that you got, is no longer accessible. As the Secretary mentioned, 1/3 of all counties in the United States no longer take Medicaid, have only one plan that you can choose from. So it's a fact right now that in most cases, you have no choice. In many cases, you've lost that ability. Our goal is to actually add more choice and more competition. Right now, the government tells you you must have this plan or you will pay a penalty. And within this plan, here's what you have to have. We've lost the element of choice and competition in healthcare. And by bringing all of that back, I think there's a higher degree of likelihood that you're going to get the plan that you want and you're going to get the doctor you want, because it'll be your choice, not the government's choice. And that's a big, big difference. This plan was jammed down everybody's throat. And the consequences took their plans away, it took their doctors away, and it drove up costs. This plan allows more competition, more people to enter it, and the American people and patients to make a decision on what plan they want. If they have a plan and a doctor they like, then they're going to choose a plan that allows them to continue with that doctor. But there's going to be more competition and more choice, not less. And that's frankly what you have now. With respect to China, I think I addressed this yesterday. We stand shoulder to shoulder with Japan and South Korea in doing what we can to protect that region in particular from an attack from North Korea. We understand the situation. We continue to work with them. As I mentioned, the President spoke to both leaders yesterday. We provided a readout of those calls. But we obviously understand the concerns of China. But this is a national security issue for them.
Question, conservatives have started to call this Obamacare light. President Trump has promised to fully repeal Obamacare, but this bill leaves a lot of the structure of Obamacare intact. If this is the policy that passes, is President Trump confident in the future he can say that he fully repealed Obamacare?
Yeah, absolutely. As I mentioned, the first half of the bill that we put forward repeals it. There are three things. Each phase that we've talked about, phase 1, phase 2, and phase 3, there's a repeal and replace aspect in each one. But Republicans and conservatives have been talking about added competition and driving costs down for decades now, selling across state lines, small business pooling. All of those things have been part of conservative plans for a long time. And I think instilling that competition in it, allowing more access. I think there's a big difference. There is no, we have for the longest time, if you're a conservative, you think about this right now, that you have anyone who has an employer-based, their job comes from an employer that gives them health care. They're getting a subsidy. They're getting a credit. They don't pay taxes on their health care, and their employer doesn't either. That's a huge disadvantage to anyone who's a sole proprietor or owns a small business. And so, frankly, to allow the playing field to be leveled and allow small businesses, which are frankly the job creators in this country, to allow entrepreneurs and self-starters to get the same tax treatment that a Fortune 500 company gets you, is a very conservative principle. And again, I think, look, one of the things that's important, Sarah, is for all of the people who have concerns about this, especially on the right, look at the size. This is the Democrats, this is us. There is, I mean, you can't get any clearer in terms of this is government, this is not. And I think that part of the reason the visual is important is that when you actually look at the difference, you realize this is what big government does. It crowds out competition, it drives up prices, it stifles entrepreneurship and innovation, doctors leaving the markets, more and more people not taking Medicaid or TRICARE. That should concern people. When you've got veterans that can't, because most of the time Medicaid and TRICARE are tied together. So when you have those systems not accepted by doctors, that means the lowest of the people on the low income scale and people who have served our country have fewer and fewer choices. That alone should be a problem and concerning for many people. But the premium spikes are another problem because, again, even if you're in the exchange, now you're seeing over and over again that happen. You're also seeing young people decide that they'd rather just pay a penalty because the cost of those basic programs is out of reach for a lot of young people who are just entering the job market. But again, I think the greatest illustration of the differences in the approaches is that size. Our bill, which is a tenth of the size, does repeal and replace in what their bill just did in massive government bureaucracy. And that is a big difference. Jim.
Just want to ask you, I mean, you had the Health and Human Services Secretary out here. You just talked about this is the Republican bill, this is the Democrat bill. Is that the president's bill? Is that his health care bill?
That is a bill that we have worked with Congress. We feel very good about where it is. We are looking forward, as I mentioned earlier, the president's meeting with the whip team to encourage them to support it and to build it out. I don't think, and I'm not trying to be cute here, but I think it's not his bill or their bill. It's a bill that we have worked on with them together. We're very proud of where it stands now. The big difference, Jim, is that unlike before, as I mentioned, when the Democrats jammed it down people's throat and said, waited to get that 60th vote before with Senator Kennedy still around, and then basically said, literally, you will have to wait and see what it looks like before we passed it. We not only posted it out there for everybody to look at, but by sending it through regular order, not just putting up for a House vote, but sending it through the committee process, allows Republicans, Democrats, and independents alike to offer up amendments and suggestions, and the House will work its will. Now, we will continue to give guidance and thoughts and suggestions, but I think the president's core principles are what's going to guide us as we head through the Hill and then the House and then to the Senate.
And just one quick follow-up on Jonathan Karl's question, because the president made a very serious allegation over the weekend, and I think we would all be remiss if we went through this briefing and not tried to get you on camera to at least offer us some evidence. Where is the evidence? Where is the proof that President Obama bugged President Trump?
Well, I answered this question yesterday on camera on your air. So just so we're clear, I know this is now will be twice, but I think I made it clear yesterday.
But since yesterday, is
nothing
there any
has changed.
new proof?
No, it's not a question of. It's not a question of new proof or less proof or whatever. It's the answer is the same, and I think that I think that there is a concern about what happened in the 2016 election. The House and Senate Intelligence Committees have the staff and the capabilities and the processes in place to look at this in a way that's objective, and that's where it should be done. And frankly, if you've seen the response from, especially on the House side, but as well as the Senate, they welcome this. And so let's let the Senate do their job and the House, Intelligence Committees, and then report back to the American people.
Will the president withdraw the accusation? Does he have any?
Why would he withdraw it until it's adjudicated? That's what we're asking. Is for them to look at this and see if there is
no regrets of him
no
about raising this accusation.
Absolutely not. And I think that what he wants them to do is to look into wiretapping, other surveillance, and again, as I mentioned before, the other leaks that are threatening our national security. You're seeing the leaks happen over and over again that come out throughout the administration, throughout government, that undermine national security. And I think the appropriate thing to do is to ask the House and the Senate to look into it. That's an important thing. John.
Sean, right now you're 2 votes short of passing repeal and replace in the Senate because you've got 4 Republican senators who are saying they can't support the bill because of rolling back the Medicaid expansion. What do you say to those senators who are very concerned that people will lose coverage, that this does not provide enough stability for those people who rely on Medicaid for their health care?
Well, there's 2 things, John. One is we're at day 1. We're going to go through the House first, so we got a little bit of time. And I think as we go through that process, these senators, and not just the additional 2, but I think and hope that we'll get additional ones that recognize that those people, as I've said over and over again here, it's if we do nothing, they're going to be in a very, very worse scenario than they are now. More and more people, if you're on Medicaid, which serves so many low-income Americans, they, as I mentioned, they have a card. And that card does not allow them to go to doctor after doctor saying, we're not going to take Medicaid or TRICARE anymore. So I would ask those senators, what are you doing to help us work on a bill that will get them insured again? Because for too many Americans, they've got a card, but they don't have insurance. And I think that's a very, very big thing, to a distinction to make. They're the ones who have the problem right now. They've got a Medicaid card and nowhere to go. And what we need to do is to make sure that low-income Americans, veterans, small business owners, individuals who desperately need health care have options and affordability.
One other piece of this. You could bring down the cost of the insurance itself through new efficiencies in the system selling across state lines, but the biggest driver of the increase in health insurance cost is the skyrocketing cost of medicine.
Right.
What in this overall plan do you propose to do to either cap the rise or even bring it down?
Well, I think the Secretary mentioned this, but I mean the cost of prescription drugs is no, it's not. It's a big factor. I think that.
But when you're paying $50,000 out of pocket to get a stent.
Right,
I mean,
but again, what is the biggest thing missing?
But it's getting out of control. So
fair enough. But
fair enough. Drugs is one part of it.
No. But
okay.
When you talk about procedures or drugs, the biggest thing that's missing in this whole equation is competition. There's no. I mean, we're down to one plan in many places. There's nothing for these places to compete.
There's competition between hospitals.
No. There's. I mean, that's fine. But if they know they're going to get the same reimbursement rate, if they know that there's no other options, that plans aren't trying to get people, then that's a big difference. Right now, there's a lack of competition in the industry, and I think one of the presidents. I get it may be one part of that, but you're right that all over medicine, procedures and such. But there's a reason he met with drug executives and talked about getting those costs down. That there's a multifaceted approach at how do we instill competition, how do we drive down costs. But you're right, we've got to do more to get the cost of that down, of the procedures, to allow additional options. Everything that, it's the same way that, again, think about your insurance, right? One of the things that was driving up costs in the past was people were exercising the option of going to an emergency room over and over again for their primary care. And what happened is that you saw all of these, quote unquote clinics pop up from around, and insurance carriers actually made it cheaper in terms of copays to go see that than an emergency room, driving people to somewhere that didn't continue to drive up costs, clog insurance. That competition alone starts saving the plans money and helping to keep costs down. We've got to instill more aspects of competition in medicine. Jennifer.
Can you give us an update on the effort to roll back regulations? Have the regulatory reform task forces identified any regulations to roll back, and have any actually been repealed?
I think that they have had their work cut out for them. They've started, as the president has met with different industries and companies, corporations, associations. That is a constant subject of discussion, which is those regulatory